welcome to Glaucoma Week, where health practitioners, especially eye doctors, put more effort in creating an awareness about glaucoma and its dangers to the world at large. I know by now the flyer for today's Glaucoma Week has been going around, especially on social media, but it's quite unfortunate that most people are yet to understand the importance of this Glaucoma Week. In accordance with this year's glaucoma theme, I'm going to be taking you through the health talk concerning glaucoma and why you should go for screening this week. So before we dive into this topic properly, let's take a look at what my colleagues have to say about this year's glaucoma.
Glaucoma is not an age-related condition. It has nothing to do with age. It has nothing to do with sex. It can come at any time, even at death, which is known as congenital glaucoma.
Glaucoma is the leading cause of irreversible blindness in the world today. Irreversible because it damages the optic nerve in the eyes, and these optic nerves do not regenerate when they are damaged.
It can also be caused by trauma. It is also hereditary. Visit an eye clinic today and
Save yourself from gradual loss of vision.
Come back to Seeing is Living, where you find vital information about your vision and also sales of optical products such as frames, protective lenses and sunglasses. And if you're just joining us for the first time, please subscribe to my YouTube channel and also follow us on the social media handles displayed on the screen. And if you have been watching my videos before now and you're yet to subscribe to my YouTube channel, kindly consider doing so, as this can push me into producing more videos like this. So we have been hearing about glaucoma. Let's take a look at what glaucoma is. Glaucoma is the chronic progressive optic nerve neuropathy, which is associated with increased intraocular pressure. The key words I want you to look at there is the optic nerve neuropathy and intraocular pressure. What is this optic nerve neuropathy? Let's take it one after the other. The optic nerve is a connection between the eye and the brain. For visual interpretation to take place, light has to reach the retina after being refracted by the cornea and the crystalline lens. On the retina, there are nerve fibers collectively known as optic nerves. This nerve is what relays electrical impulses from the eye to the brain. Now, optic nerve neuropathy means a damage to this optic nerve, which is a connection between the eyes and the brain. When there is a damage to this optic nerve, it means that electrical impulses from the eye will not be relayed to the brain. Let's look at the second keyword there, which is intraocular pressure. The intraocular pressure is the force needed to keep the eye in shape, or the force that helps to maintain the shape of the eye. Now let's look at it as a mobile tire that requires air to stay in shape. Unlike the car tire that leaks air, the eye needs a fluid to maintain its shape. And this fluid is known as aqueous humor, which originates from blood, enters the eye when there is a heartbeat. With each heartbeat, a small amount of fluid from the blood enters the eye and is being filtered by the ciliary process into the posterior chamber. Sorry, I know this grammar, this medical terms might sound too ridiculous for you, but I will try as much as I can to break each word down for better understanding. What I am calling the posterior part is the back part of the eye. So when this fluid enters the eye from the back part of the eye, it flows towards the anterior chamber or the front part of the eyes, where it provides nourishment to the crystalline lens and the cornea, which invariably means that this fluid does not only maintain the shape of the eye, it also provides nourishment to these avascular structures of the eyes. It leaves the eye from the anterior chamber and goes back into the blood. So for the pressure of the eye to be normal, the inflow and outflow of this aqueous humor has to be at equilibrium. So what I'm trying to say in this sense is that with a heartbeat, when there is an inflow of this fluid from the posterior chamber, there should be an outflow of those that were in the eye already from the anterior chamber. This is the case for a person with normal intraocular pressure or normal eye pressure. Unfortunately, the drainage of this aqueous humor might be compromised, and this alters the outflow of the aqueous humor, leading to accumulation of the aqueous humor in the eye, which invariably results to increase in intraocular pressure of the eye. And this increased intraocular pressure in the eye is the major cause of glaucoma. And the question is, how does this result to glaucoma or damage to the optic nerve? Elevated intraocular pressure poses a harm to the optic nerve by compressing the optic nerve head, which is fragile in nature, subsequently leading to lack of blood supply to the optic nerve. If this is not dictated or the pressure controlled on time, and there is constant elevated intraocular pressure, it can lead to death of the optic nerve or damage of the optic nerve due to lack of blood supply to these nerves. When there is damage to the optic nerves that relay electrical impulses from the retina to the brain, this will invariably mean that electrical impulses from the retina will no longer be relayed to the brain. The end product is usually reduced vision or blindness. This is how increased intraocular pressure damages the optic nerve, resulting to glaucoma. There are different types of glaucoma, but for the purpose of this video, I am going to be talking about the three major types of glaucoma. The number one is the primary open angle glaucoma. In primary open angle glaucoma, there is usually a default in the drainage system of the fluid in the eye, which usually leads to build-up of this HSMO and of course increment in the intraocular pressure. This type of glaucoma is actually the most common type and is usually asymptomatic, as it often occurs without any noticeable symptom. Mostly the first sign of this type of glaucoma is blindness, meaning that 90% of people with this type of glaucoma are not aware that they have it until when they have started experiencing drastic loss of vision or they are blind already. The second type is the angle closure glaucoma. This is a type of glaucoma that occurs that colored part of the eye known as iris blocks the outflow of the aqueous-humor. This also results to increased intraocular pressure because the outflow is blocked by the iris. This blockage usually leads to build-up of this fluid in the eye, which adversely results to glaucoma. This type of glaucoma is usually associated with redness, pain and headache, and this can make the person involved to go to a hospital, unlike open angle glaucoma, which does not show any symptoms. The third type of glaucoma is the normal tension glaucoma. This is a case where glaucoma occurs or there is damage to the optic nerve even with normal intraocular pressure, meaning that a person can have glaucoma even with normal eye pressure. People at risk of developing glaucoma include people above 40 years. If you are above 40 years, you are at risk of having glaucoma. All the people above 60 years are at risk of having glaucoma. Another important risk factor of having glaucoma is family history. I'm talking about those who have had a history of either their mother, their father, grandparents having glaucoma, especially those whose grandparents or parents got blind due to glaucoma. So if you had a history of someone in your family having glaucoma, either your father, your mother, grandparents, or your uncle, you are at risk of having glaucoma. The other set of people at risk of having glaucoma are diabetic patients. I've been having people asking me since 2 days ago about glaucoma and if glaucoma can be cured. The answer is no. Glaucoma does not have any cure but can be managed. Now this is because of the complication in glaucoma, which is associated with damage to the optic nerve. So if glaucoma can be cured or treated, as the case may be, it means that there should be a way to repair the optic nerve, and which doctors and scientists have not discovered. So as it is now, glaucoma does not have any cure, can only be managed, and management depends on early detection. In the case of closed angle glaucoma, because the angle is closed, doctors have been making efforts to manage this type of glaucoma by opening the drainage channel using laser. Since the invention of the laser surgery in closed angle glaucoma management, the prognosis has not been satisfying, which means that there is still no cure for glaucoma, but we manage using eye drops and tablets, which helps to support the optic nerve and to reduce the intraocular pressure. How do we prevent this chronic disease that steals people's sight? Now, this is the major reason why I'm making this video. Creating an awareness where people will be encouraged to go to the hospital to have themselves screened for glaucoma. The best way of preventing this disease is by going for a comprehensive glaucoma screening. This week that most hospitals are celebrating the glaucoma week by screening people for glaucoma free of charge. For this screening, it helps to dictate any symptoms and signs of glaucoma and is being haunted when detected earlier, thereby helping to prevent loss of vision in subsequent time. Glaucoma is so deadly that someone you saw yesterday, they can tell you that this person cannot see again. You think it's village people. Sometimes some of these cases are not village people. It is usually due to our ignorance. It does not give you any symptom, especially in case of open angle glaucoma, where it starts eating up the peripheral vision of the affected person and making you to have just a narrow or tunnel vision. Unfortunately, most people don't even take cognizance of this. Just 1 out of 10 persons that are lucky to have glaucoma in one eye. Usually this occurs in 2 eyes. Remember that the damage done by glaucoma cannot be reversed. That is why it is the leading cause of irreversible blindness. So why don't you run to a nearest hospital to see an eye doctor for glaucoma screening? Because early detection is what saves your vision. Early detection is the best management and cure to glaucoma.